I'm Stephanie Lindeman. Welcome to the Stairway to Healthcare video blog. Today is Friday, December 22nd. We are getting very close to the end of the calendar year, and this is a time when a lot of people are making some last minute charitable donations. And I wanted to talk to you a bit about my suggestion for where you might want to put some of those donation dollars to show your support for health equity and for increasing access to high quality healthcare for everyone. But before I get to that, I want to do a quick legislative roundup because Congress did yesterday pass a continuing resolution before they break for the holidays. This continuing resolution will continue to fund the government, which was on the brink of a shutdown. I don't know that everybody realized that. This one seemed to have gotten slightly less press than the prior ones. I don't know if that was because we were so focused on the tax reform bill, or if we've just kind of gotten used to the possibility that our government might shut down. This kind of happens every couple of months. I hope it's not that, but at any rate, they did pass this continuing resolution that will continue to fund the government and allow it to. I was going to say function, but functioning seems like a strong way to describe what's happening in government right now. But let's just say the government's going to keep being funded until January 19th, by which point they have to actually pass a budget for the current fiscal year. But there were a few things that were contained in that continuing resolution that were important that I want to talk about. One of them is a waiver of mandatory spending cuts that would have kicked in January. Those cuts would have been triggered by the deficit increase that is going to result from the tax bill. So the provisions of the tax bill, they actually increase the deficit by $1.5 trillion, and that deficit increase is not offset by revenue. So when that happens, it triggers automatic spending cuts to make up for the deficit increase, except the Congress can waive that. And they've done that in this case. Those mandatory cuts would have been across the board, and they would have included $25 billion in cuts to Medicare. So because those cuts have been waived, we have some relief now from those potential cuts to Medicare. Doesn't mean Medicare can't be cut in some other way, but there won't be those automatic cuts. The other things that were contained in that continuing resolution are continued short-term funding for the Children's Health Insurance Program, also known as CHIP, and for the Community Health Center Program. Now, funding for both of these programs expired as of September 30th and has not been reauthorized for the current year. And both programs were starting to run out of money. So this temporary continuation of funding is really important as a bridge to get both of these programs a little bit farther. This means now certain states had been starting to notify families that their children might no longer be covered under CHIP because the states were running out of funds. There were community health centers that had instituted hiring freezes and that had discontinued some of their programs or were looking to discontinue some of their programs because of this. Either because they were actually running out of money or because they were trying to conserve funds in the anticipation that they were going to run out of money. So this temporary restoration of funding for the next 6 months, or for 6 months, it's not actually for the next 6 months because it's retroactive, helps these programs to continue for a little while longer. So there's some little silver linings there. So that actually does bring me right to my topic of your charitable donations, and I want to suggest to you that you consider your local community health center. Community health centers are also called federally qualified health centers. They do get federal funding. Um, they are also nonprofit organizations, 501c3s, so your donation will be tax deductible. They provide care to anyone who walks through their doors as part of their federal mandate. They are required to serve everyone, whether they have private insurance, Medicaid, no insurance, whether they can pay, they can't pay. They are located in medically underserved areas. They serve populations that often have difficulty getting access to quality health care. Their patients are often low income. They often have a lot of co-occurring chronic conditions, things like hypertension and diabetes, and they really focus on the whole patient, and they do a great job of helping patients manage their health. They deliver really high quality primary care and preventive care. They help people live healthier, happier lives. Their boards of directors are made up primarily of community members, people they're serving. And they really do look at the whole patient and the patient's experiences. They provide care in patients' language. If you are not comfortable in English as your first language, they will take care of you in your language. Um, Many of them have social workers on site. They'll help people apply for public assistance, um, SNAP, food stamps, um, WIC, all of those things. So these are great places. They have great health outcomes. Their patients really feel very comfortable there. And this has been a nerve-wracking time for them because of the fact that their funding wasn't reauthorized. And even though they are getting temporary funding back right now, their future is still uncertain. And that gap, that dip that they have, it also took a financial toll on them. If they shut down and then have to ramp up a program again, that costs something. Um, it's just, I really hope you will consider giving to them. If you don't know where your local community center is, and I promise you there is a community center somewhere nearby to you. These places serve 26 million people across the country. So if you would like to know which is the one that is closest to you, you can go. Hang on. You can go to findahealthcenter.hrsa.gov, and I will put that link down below. You go there, you put in your zip code or your address, and it will give you back the locations of all of your local health centers. Most of these health centers have their own websites, and you can often donate to them right through the website. If they don't have that capability on their website, I encourage you to please just give them a call. Tell them you appreciate their mission, you appreciate what they're doing, you'd like to write them a check, and who should you make it out to? And please consider them. You can also consider your primary care association. There are state and regional primary care associations all across the United States. These associations are the associations for community health centers. They provide a tremendous amount of technical support. They help the health centers meet their federal requirements and really support them in providing the high quality care that they provide. They also get federal funding. But the other thing that the PCAs do is advocate on behalf of the health centers, and that's an activity that is not covered by federal funding. As a matter of fact, they are barred from using any of their federal dollars to pay for their advocacy work. And right now is a time when PCAs have really been putting in a lot of hard work in terms of advocacy. to try to get the funding for the program restored. And so to pay for those activities, they use their membership dues, other kind of discretionary funds that they get in that aren't earmarked for something else, that aren't government funds. But those are also the funds they have to use to pay for a lot of the operations and infrastructure for the PCA. So I encourage you to, if you don't feel like, the community health center is really enough in your community that you want to give to it, or for whatever reason, you can also consider giving to your primary care association. They either cover a single state, or sometimes there's a few states grouped together in a regional PCA. And so you can find out who your PCA is by going to the website of the National Association of Community Health Centers, nachc.org. I will include the link to get you directly to the list of PCAs. And again, it will have the contact information as well as the website. And a lot of the PCAs also have a donate button right there on the website. So I encourage you to consider that. One final thing when you're thinking about whether you might like to give to a primary care association, community health centers really play a critical role in communities that are hit by natural disasters. They are often the only non-emergency medical provider that remain open, and they're there to help their patients continue to manage their chronic conditions. I was working for the State Primary Care Association in New York, the Community Healthcare Association of New York State, when Hurricane Sandy hit. And I can tell you that our health centers were really important to the communities that they serve during that time. The communities that were the hardest hit out in the Rockaways and out in far Brooklyn, Coney Island area, those health centers were really important. And even though some of them had to close their actual health center locations, they found ways to continue to operate through mobile units, vans, so that they could do things like make sure people's blood sugar was staying under control, monitoring blood pressure, helping them to follow up and get refills on their medication. So, and in those circumstances, the Primary Care Association really provides a lot of support to the health centers, helping them get resources, helping them coordinate resources, and helping them get their main locations back up and operating again as soon as possible. So you might want to consider giving to primary care associations in locations that have been hit by hurricanes and fires recently. So the Texas Association of Community Health Centers. There are multiple primary care associations out in California. And also there is a primary care association for Puerto Rico. And so all of those are listed on that PCA list as well that I'm going to link to. So you may want to give to the PCA in your state, or you may want to help out the PCAs in those places where community health centers are really drawing very much on their PCA for support as they recover from these natural disasters. So that is my pitch for where you may want to consider putting your hard-earned cash as you think about what kind of charitable giving you want to do at the end of the year. And primary care associations are also nonprofit organizations, so that donation is tax deductible as well. Before I finish up, I want to go off script a little bit and talk briefly about self-care. I know that's not really within the wheelhouse of the Stairway to Healthcare blog, but we've had a lot of pressures on us, the political environment, what's going on in the world, what we're seeing every day in terms of violence and in terms of harassment and just about all of the things that come at us in the news every day. We're under a lot of stress. And so I want to talk about in light of that self-care. Um, Also, it's holiday time, and holidays can be a joyous and festive time, but for a lot of people, they're also emotionally difficult, and that can add to the stress we're feeling. So, I want to encourage you to um, take a break, be gentle with yourself, and if being with family and um, enjoying them and taking part in your holiday traditions is something that makes you feel good, then I encourage you to throw yourself into that wholeheartedly. If being with your family is something that kind of stresses you out, I know you don't always have the option to not do that, but make sure you build in some time for yourself to pause and do things that are restorative for you, and maybe also take some time to spend time with people who don't stress you out. Okay, that's all for me. If you're celebrating, I want to wish you a very Merry Christmas. Um, and I want to wish everybody a really happy new year. And I will see you again on the